Well, in other news, hospitals are taking a more active role in working to lower the gun violence epidemic in our country, as they are no longer just saving lives, but helping to repair them. Dan Grossman shows us a program that offers care long after their patients have left the hospital.
The moments that happen inside trauma operating rooms are critical. It's the decisions that are made when lives can be saved. But hospitals are now taking more active approaches in not just the immediate care, but the long-term care to reduce the number of gun violence victims in our country.
Medical response team.
This is when the moments matter most.
Emergency department, how can I help you? Yes, that's
when decisions determine care and seconds determine fates. Fates like Marcellus Whitehead's.
I seen that gun when he got out of the car. I was like, I'm about to die.
On February 1st of last year, Marcellus was shot 9 times when the underprivileged kids he mentors got into an argument at a basketball game. He was transferred to Sentara Norfolk General Hospital in Norfolk, Virginia, where surgeons tended to gunshot wounds to his face, shoulder, and legs.
I was scared. I was real scared. I'm like, yo, I got little kids, yo. I ain't about to see them grow up.
Marcellus was just one of 551 gunshot victims who came to Norfolk General in 2022, the most in its history.
This happens 24/7 and haven't really been able to predict when it's going to happen.
Dr. Jay Collins has worked as a trauma surgeon at Norfolk General for the last 21 years, and it's a story so many other hospitals across the nation have seen. Since 2012, the rate of gun violence deaths per 100,000 people in our country has increased by 39%, meaning there are 15,000 more gun violence victims now than then.
Gone up dramatically, and even in just the last 5 years, it's gone up. We've almost doubled what we did approximately 4 years ago.
It's why hospitals are now taking a proactive approach to reduce the numbers however they can.
You know, sometimes this may be the one event that makes people look at their life and say, well, I need to make some changes.
Valeria Mitchell has been the trauma program manager at Norfolk General since 1992. But over the last 3 years, she has worked with other hospital administrators to implement the Foresight program. It helps put victims in touch with long-term mental health care after they've been discharged from the hospital. According to Everytown research, 2/3 of gunshot survivors in 2022 expressed the need for these services as they recover.
It is a slow process. We're talking about violence is an indicator to something so much bigger, trauma. And this is generational trauma.
Angela Parker is the team coordinator for the program, as it is work to not only treat gunshot victims for their immediate wounds, but the deeper scars they leave. It not only helps connect survivors to psychiatrists, but also to insurance reps and groups that can find them jobs to change their lives.
Ooh, y'all, look, he's walking.
For Marcellus,
He looks better.
that help came in art therapy, as he not only recovers from the trauma of his battle, but the devastation he felt after losing a daughter to gun violence in 2019.
I love art therapy. Talking and then doing different types of drawings, putting pictures and stuff together. I felt safe, to tell you the truth. I felt kind of safe. Then I can like relax and express myself how I really feel.
Parker thinks the program can be a model to other hospitals after the successes at Norfolk General, showing it's not just these moments that matter most, but the ones that come after a life is saved. Dan Grossman, Scripps News, Norfolk, Virginia.